Welcome to today's broadcast. My name is Colleen Patterson, and I am the Director of Employer Services and Compliance at Savoy. I wanted to take a few moments today and share information about frequently asked questions that we have been receiving over the last several days. The first question has to do with HIPAA. Considering many of our broker partners interact directly with employees of clients, this question actually is a great one to ask. So what's come in is, does the broker have a legal responsibility to alert the employer that an employee is in contact with an individual who has symptoms of COVID-19? Great question. But what we want to remember are things that we already know. Current HIPAA privacy and security rules are intact. The broker's obligation as a HIPAA business associate to the covered entity, which in this case is the plan, would prohibit the broker from sharing this information with the employer. The employee may decide on their own to notify the employer. However, the broker should not be making this report. HIPAA is very clear that disclosing this PHI to the employer would be a breach of privacy rules. HHS also released guidance reminding covered entities and business associates that they cannot disclose this information, including as it relates to coronavirus or potential coronavirus infection. I think this question has popped up lately because HIPAA actually was in the news earlier this week. On March 17th, the Department of Health and Human Services Secretary Alex Azar issued a limited waiver of certain HIPAA sanctions to provide data sharing and patient care during the pandemic. The waiver really applies, though, to hospitals, outlining that they will not be penalized for failing to comply with HIPAA requirements found in Title 45 of the Code of Federal Regulations. We do have more information on the waiver on our website, which you can find under the COVID-19 resources page. So a second frequently asked question that has come in is there information available on COVID-19 state testing sites? I thought this was really interesting because, as we've all seen, this is definitely fluid information, as testing sites appear to be popping up daily. Most important is to follow the recommendations of the CDC, which is to consult with a medical professional. State websites do have information regarding testing instructions, should you or someone be in need. Lastly, the questions that we have received the most this week, and literally at this point, we've probably gotten this question, I don't even know, more than 100 times, I think, at this point. They really surround layoffs and furloughs, and the questions range from what happens with COBRA? What are the carriers allowing? What are carriers doing? What about the payment of premiums? How do we collect this from our employees, and so on? We provided detailed information in the COVID-19 resource section of the website regarding layoffs versus furloughs, and really understanding the differences from a compliance standpoint. But there are some really important considerations when you think about this. The first one is, let us not forget that employees working less than the hours for eligibility in the policy, COBRA or continuation, does apply. Group size is what's going to determine if it's federal COBRA or state continuation. So a layoff or furlough, they really are a reduction of hours. So always remember that COBRA or continuation is important. To expand upon yesterday's message regarding COBRA, I wanted to just say a few more things on that. A person who elects COBRA or continuation will have to exhaust it before becoming eligible for individual coverage, and will not be able to apply for subsidy that otherwise they may have qualified for. However, I wanted to make sure that everybody understood that they can, at the next federal open enrollment, purchase an individual policy. Likewise, if they become eligible for a new employer's group plan, they may enroll once they satisfy the eligibility waiting period. So again, rules that we already know, they still do apply. The second consideration to think about when you're getting asked questions about layoffs and furloughs and what happens, when questions about what happens to eligibility during a reduction of hours, of which furlough and layoffs actually fall into, answers can be found in the plan document. Remember that the purpose of a plan document describes the plan's terms and conditions related to the operation and administration of the plan. That truly is the employer's guide. If employers wish to maintain eligibility for employees on furlough, the plan document may need to be amended to allow for the continued eligibility. It's also important to note that the plan sponsor will want to get carrier approval for fully insured plans or stop-loss approval for self-insured plans. Carrier information and updates around eligibility and what carriers are going to allow or not allow, for that matter, is coming out rapidly. So expect to receive more information on that in the coming days and weeks. Should you have any questions, please continue to reach out to your dedicated Savoy team. Please be sure to visit our website, savoyassociates.com, to stay up to date with all of the information that we are releasing. It is Friday, and we have made it through the first week. Savoy is committed to helping all of our partners and associates navigate these unsettled times. From all of us here at Savoy, stay healthy and safe. Thank you for joining us today.